Hello, I'm Alistair McClellan, the editor of HSJ. Welcome to our roundtable on unwarranted variation in NHS care. It is hard to think of a more important issue facing the NHS. Nobody is likely to arrive with sackloads of cash anytime soon to help the NHS out of its current bind. If the NHS is to survive and to prosper, it must become more efficient. Becoming more efficient means dealing with variation.
We have reviewed 258 hospitals, not only in England, but also Scotland, Northern Ireland and Wales. And in elective orthopaedics, we've demonstrated significant variation in outcomes and treatments, which we believe, if standardised and the reduction of variation carried out with the support of the BOA, can improve the quality of care for patients, reduce complications, and make significant savings for the NHS.
One of the things we've done in my own hospital is look at the processes in the outpatient booking office. What we discovered within ophthalmology was that a routine referral was arriving on paper, and it would be 80 days before an appointment was even given to a patient, not until the patient was seen. This was because paper letters were batched and then farmed out to consultants to review the urgency, handed around, and then they came back into the booking office. We've now been able to reduce that 80-day process down to 3 days, which means we've taken a whole non-value adding bit of activity as far as the patient sees out of the process.
We are very interested in variation as an organisation. We benchmark ourselves in lots of different ways. Some of these are efficiency measures, length of stay, readmission rates. And I suppose for me, the main interest or the main sort of trick is how do we find things that are both engaging to the clinical community, but also of benefit both to our patients, to our outcomes, and to the trust financially.
Going into trusts and starting with the variation before getting to what the solution to that variation might be, and enabling clinicians in their local context to find those solutions. For me, that's a much more powerful and potent approach than starting with, this is the solution to the variation that I see, now go away and implement this solution, which totally disempowers clinicians, doesn't get them owning the problem in the first place, and actually potentially in some situations will drive poorer outcomes because the solution may not be appropriate for that environment.
Our vision is really to enable surgical systems to make sense. And what we mean by this is using digital solutions that can reduce human error, but not humans, from the surgical system, to provide data and insights that really provide real-time information to clinicians to make immediate and improved decision making when they need it.
We need to understand exactly what is happening with our patients and those aspects of care that impact on how we use our money, so cost of various different items that we use, and to ensure that we're getting best value for the taxpayer, we're getting best outcomes for our patients, and where we're not, we're very clear about why we're not.